So HHS is an academy here at Utica High School where kids who are looking to go into the healthcare field can spend all 4 years in that pathway.
We looked at 3 pathways, therapeutic medicine, rehabilitation medicine, and then public service. And each of those pathways, the goal was to give kids options. Some of those options would allow students to take that and move on to college and post-secondary education. And then there's another one that we have that students could go and they could get training and then be able to maybe walk right out of high school, do like some short-term training and go right into the workforce.
Today's students don't learn like we do, so to give them this opportunity to do a lot of cool hands-on skills that is beyond what they're used to, like sitting in class, taking notes, watching a PowerPoint, that type of stuff. We're really trying to recreate the exact same things and skills that they would be doing in a real medical setting, whichever pathway they end up choosing.
It gives the kids an opportunity to be with a cohort of students and like-minded and teachers who are planning together and they're talking to each other, planning with the kids, getting to know the parents, the families really very, very well. And all the academics is centered around health and human services. Our history class, our English class, our social studies class, our math class are all based to trying to be as unit-based and uniform as possible.
The whole high school experience is absolutely addressed here. I think some people question the connection between English and the medical academy only because it seems as if English is kind of the one who lives the farthest away, so to speak. So a lot of our efforts work to try to support the soft skills, the presentation skills, the collaboration skills, things like that. Even I was kind of curious about how is this going to be, are we talking medicine every day? But they do still get the core experience, just again, kind of through that medical lens.
Ever since I kid, I was really interested in medical professions, and I watched a ton of medical shows as a kid, and honestly, this seemed like a really good idea for me.
It made me excited because it was something that I wanted to learn for a long time. I didn't get that when I was in regular science. Since I was little, I've always wanted to be a doctor, so I felt like the academy would be a good way to test the waters before actually paying the money and going to college to be a medical student. So I really like that the academy allows me to figure out what I want to do.
For me, I want to go into therapeutic because that's what doctors and the ones cardiologists they go into, which more interests me.
My favorite part of the program is how it's kind of like a family. All the students have the same classes and they're in the same courses and stuff, so it's really we can all help each other.
Freshman and sophomore year, we're going to get them as much exposure to those 3 pathways so then they can try to have as much information to make a good decision for themselves in the future. And then at the end of their sophomore year, we start the steps of choosing that pathway and then putting them in that pathway for their junior and senior year.
And then their senior year, we're really hoping to kind of even take that one step further and get them into a school to work program where they can actually leave school early, go out into the medical field, get a job, start working, get paid, earn high school credit, and really help them make that decision. This is really what I want to do, so that when they decide either after graduation to go on to post-secondary, they have that mindset of, yes, this is what I want to do. We can help them see there's engineering opportunities, there's business opportunities, and they can still have a very successful career in the medical field, even if they don't want to do that direct hands-on patient care.
If you're really interested in medical field or even just going into public safety, I feel like this is a really good fit.